my program, Dentistry Uncensored, because it just is, and I like to talk about the 4,000-pound elephant in the room. I want to start with something that everybody gets mad at me when I talk about, but I just want to just throw it out there. It seems like there's 9 specialties in dentistry, and 8 of them, like say the endodontist, he'll help you do anything you want to ask him in endo because he knows you're going to do the incisors and you're not going to retreat molars. The oral surgeon will help you do anything with an extraction because he knows you're going to send them, wisdom deep. But it seems like the orthodontists do not want to help any general dental dentist. They just say, you just send it all to me and I'm not going to help you from Invisalign to a class 1 molar. Am I just sensing that, or do you sense that too?
No, I think it's changed a lot in the last 30 years, but nowhere near to where it should be, and no 100% agreement with you. And that's one of the reasons I decided to do what I was doing. But as long as you raise that question, and it is the elephant in the room, for the first probably 15 years that I was doing this, I was, frankly, ostracized by a lot of the orthodontists. They still didn't believe that an orthodontist...
You were blackballed.
Yeah, that's a good way of putting it. They didn't believe that an orthodontist from within the fraternity should be out there teaching general dentists, and people would come to me, actually. They wouldn't come to me, they'd bump into me accidentally, because I literally remember walking down the street and seeing friends who used to be my friends who I played golf with and was on the faculty with them, and they'd cross over the other side of the street because I was teaching general dentist orthodontics. And that was kind of a personal thing, but the reality of it was that when someone says to me, well, you're teaching general dentist orthodontics, and they did it with a kind of it didn't have a nice tone to it, it was a critical tone, my answer was, who do you think I was teaching at the university? Those were general dentists. There just were 10 of them at a time. Now, the difference is I'm teaching 50 at a time. So the idea of teaching general dentists is okay in the orthodontist mind, as long as we maintain a small number of people that we're training and putting out there in a competitive environment. I understand the business side of it, but when I started doing this, Howard, I took some surveys at first because I knew I was going to be criticized and, if you want, ostracized. And I started evaluating the referral patterns that general dentists had before they took my course. And to make a long story short, what I found after the first 5 or 6, 7 years of doing this, that the general dentists that I had the opportunity to train were doing a lot of orthodontics, and they were doing it to the standard of care that an orthodontist does it. But they were referring 400% of the number of patients that they were referring before they took the course. Now, some orthodontists bought that, and really I actually started getting calls from orthodontists saying, thanks, you're doing a great job. My referrals are much more educated now. I'm actually seeing more referrals. But by and large, the major part of the orthodontic community still feels what you just described, that we shouldn't be teaching the general dentists orthodontics. I can give you some reasons, and some of them are valid unless they get the proper kind of education. You mentioned that 8 out of the 9 specialties have no qualms with teaching general dentists orthodontics. Let me tell you 2 aspects of that same question. Why isn't orthodontics taught at the undergraduate level in the dental school? And then extending that, why don't we teach, or why aren't orthodontists comfortable teaching general dentist orthodontics outside the university? Orthodontics is different. Okay? That doesn't mean it's better, it's worse, it's different. Main difference is a unit of crown and bridge or a unit of endo treatment can be done measured in a matter of hours, maybe days if you have to wait for the lab work. Therefore, you can do it on a repeatable basis over and over and over again while you're in dental school. And you can teach a general dentist effectively how to do endodontics or crown and bridge by doing 100 restorations. 1 unit of orthodontics takes 2 to 3 years to complete, and then another 2 to 3 years to see if it worked, and to what extent it worked, and to what extent it's going to change. So the nature of the treatment is much more longitudinal, therefore, from a management standpoint, much harder to do in dental school. So I understand that. That doesn't mean it can't be done, or it shouldn't have been done, but that was possibly a legitimate part of the argument about you really generalists are crickets. Again, I can show you how to do an upper root canal in a matter of an hour, and you can do 50 of them, and you're pretty good at it. You can't do that with orthodontics. The other aspect of it that orthodontists try to use as why they shouldn't be teaching general dentists is that it's based on totally different principles than what we learned in dental school. In dental school, we don't study, any of us, don't study bone-muscle interaction. We don't study craniofacial growth and development. We don't study genetics. We don't study form-function relationships. So the fundamental basis of orthodontics is very different from the things that dentists learn in dental school. And I think back to when I first started looking at this, and I ran 2 departments. And let's go back to the University of Detroit. In 1971, In 1970, I became the chairman there, and I spent the next 11 years trying to integrate an orthodontic program into the general dental curriculum. I had 10 hours in the curriculum during 4 years. Our Crown and Bridge department at the University of Detroit had 900 hours. The emphasis was obviously on Crown and Bridge because those were the powers that ran the dental school, but just as importantly, when a young man or woman gets out of dental school, there's really nothing on the state boards that is required any information about orthodontics. So the students were looking at what they had to complete and what they had to learn to get out of dental school, and then secondarily to pass the boards. And the faculty was primarily interested in teaching graduate students, so the gap just went unfilled. The problem for me is that it not only led to, as you just used the term, blackballed or ostracizing people who tried to teach general dentists, it led to a bunch of short courses, misinformation, and inappropriate education that finally did become available for the general practitioner outside of school. People from within the community, like myself, were not willing to do it. So what they got was others filling the void. And I've spent probably 20 years of my career trying to undo some of the misinformation that's spread out, that is given to general dentists by unqualified educators, if you will.
You want to call any out or any camps out or any?
No, I don't want to call any camps out. I will tell you.
It is dentistry uncensored, and no one will argue with two old both guys.
It's okay. It's not a personal thing.
No, I know it's not personal, but I have always told these dentists who are going to these short-term ortho courses, whether it be 6 months smile, 6 month brace, whatever. I always say, first get your foundation. Go see Richard and learn classic orthodontics that your orthodontist does. Why don't you? That's the base of the pyramid. Then you can go up and learn some aligners and things like short term. Do you agree with that assessment or not?
Not only do I agree with that, I'd pay you to keep saying it. I couldn't say it any better. It's exactly what I say.
Why don't you write an editorial about that for Dental Town magazine? Why don't you write an opinion piece on that? That if you want to do short term ortho, 6 month smiles, 6 month braces.